Good morning, everybody.
Yes, good morning and welcome back to the DVAS table. I'm Laura.
And I am Rebecca. Hello, everyone. Great to see you.
So we'd like to start this morning talking about an update regarding COVID and what's happening now in Vermont. Really, COVID is still here. It's still spreading. There is an uptick in cases. Things haven't really improved yet for all of us, but we still encourage people to go ahead and get vaccinated just to prevent having more serious symptoms. And if you haven't been vaccinated, please go ahead and do that. I know it's hard sometimes, but we'd love to encourage you to do that. And again, continue wearing masks and follow all the safety procedures that you need to do to keep yourself safe from COVID. COVID right now has a new variant called the Omicron variant. And that's also spreading as well. And I think it started in Europe. Do you remember, Rebecca, where it actually started?
I am not sure where that originated. I want to say maybe Africa, but I could be wrong.
Oh, you're right. You're right. It was in Africa. Thank you for reminding me about that. So it started there and it has spread consistently, and now it's in the United States. So really, they're doing more research on that and seeing how they can cope with that, but it is continuing to spread. So again, we encourage people to get vaccinated, continue to wear your masks, take care of yourself, and this is something that will probably be ongoing.
And just to let you know, Omicron has been detected in the United States. And just like the other variants, like Delta, we're always going to see more variants with the virus. So the doctors right now and scientists are really researching specifically Omicron to learn more about it and what that particular strain is like and how to prevent it, to see what is going to come our way, if it's going to be worse than Delta or less than Delta. As far as we know right now, Omicron is very easily transmissible, especially if you do not have the vaccination in your body. But anybody could get the variant. But with the vaccine, you recover a little bit better than those who are unvaccinated. So again, same concept as what Laura said. Your best bet to protect yourself is to get the vaccination and wear your masks. So hopefully we will get through this pandemic sooner than later. Goodness.
Yeah, it's teamwork, really. We all have to work together as a community, as a people, just to continue with this process so that it will go away. If we want things to get better and we want these numbers to go down, we really have to follow all the guidelines and be patient as we go through this process.
And for those who are not yet vaccinated but want to get vaccinated, you still can. It's never too late. I know early on there was kind of a specific way they were rolling it out, but at this point the vaccines are available for anyone who is eligible. Please look at the Vermont Department of Health website and see how you can sign up for your vaccine.
Exactly.
So let's shift to a higher note, a little bit of good news. So in Vermont, with Deaf Vermonters Advocacy Services, it's been myself and Laura. We have just added on a new member of our team, Stuart Soboleski, which is great news. So Stuart lives in the very northern sector of Vermont, and he is now an advocate for DVAS. So there are 3 of us on board. He is male, he is deaf, and if you would like to have an advocate who is male or someone up north, he's available for you. I'll put all of his contact information on our DVAS website, so please take a look. Really excited to have him with us.
Me too. Yes, I'm really looking forward to working with Stuart and just bringing more services that we can provide from DVAS's perspective.
Absolutely. Yeah, we like to look at our community and see, how we're doing. And another great thing to note is the Eternals movie. Now, mind you, I haven't watched it. Have you?
I have. Yes, I have.
There's a woman named Lauren Ridloff, who is a deaf actor, and she is in the Eternals movie. She's one of the main characters, and I've heard great things. Laura, can you talk a little bit more about that?
Yeah, sure. Oh, it's a great movie. I really enjoyed watching it. It's very different than some of the other Marvel movies that are out, for sure. And to have a deaf character in this movie, that's so fantastic. And, just to show more diversity, deaf community, deaf folks have a lot to offer. So it's just really cool to see a deaf character out there representing, and we'll see more about what happens with her story in this Marvel movie. So hopefully we will see more deaf characters as well in ongoing movies and TV shows in the future.
Great. And I also remember you mentioned there is another deaf actor on a TV series, Alkea Cox, and she is in something called Hawkeye. Is that correct?
Yes, it's on Disney Plus. It's really a cool series if you watch it. It's about a man who was also in other Marvel movies, and his main character works with a Black Widow. And, she's also in another movie as well, but they're very close, these two characters. And Hawkeye focuses on this man and his story, and also includes this female character who uses like arrows and works alongside him. And this woman is deaf herself. So she's kind of a badass, to be honest. She kind of hangs out with a bad group, but it's just really cool to see what happens. And she's going to end up having her own story, kind of a spin-off as well, a show about her character who's called Echo. So it'll be great to see how her character develops through the series.
Wow.
So I know she works with a male character, and yeah, they're both be showing up in this series. So if you continue to watch it, it's great. There's a lot of action involved. It's a lot of fun to watch.
Oh, that's so wonderful to see more and more deaf talent really out there in the public eye throughout the United States and in major motion pictures and on television series. I should add one more. I'm not sure if you're aware of this or if you've seen it. The Riverside School for the Deaf in California, they have a deaf football team. It's a high school football team, and they got into a championship game and they won the entire series. So they went to the state championship and they were hoping to take it all, but they unfortunately did it, but really got national publicity because a deaf team made it so far to the state football competition. I think ESPN did a whole series on them, did interviews with the team, really phenomenal. I'm just so psyched for those high school students. So yay us.
Yeah, I saw a little bit about that. It was on the news and a variety of shows, like the New York Times. I read about it there. It's just really impactful to see how the deaf community is getting more of a lens right now. So it's so exciting to see how well this deaf team was doing and how capable they are just to get through what they need to get through to get to that level of competition. And especially in sports. Wow. I mean, that can be really tough. It's just, yeah, I think it's cool when you think about all that.
Absolutely. It's so exciting to have recognition out there of members of our community. So let's hone back in on Vermont. So admittedly, Vermont has been struggling with the Agency of Education, and deaf, hard of hearing, deafblind folks within the public school system really need services to have full access to their education. And the Agency of Education awarded a grant to a new entity that none of us in the community really knew or agreed with for that specific task. And their job is to provide services. So we have actually written to the AOE, DVAS, as well as parents and a couple of organizations. We are trying to fight to make sure students are getting what they need. So we have talked with the Agency of Education. We worked with Vermont Association of the Deaf, Voc Rehab, Vermont Registry of Interpreters for the Deaf, to name a few, to really do this collaboratively and see how we can really obtain better services and even recognition within our community at the state level. We did get interviewed by BT Digger, and there is an article out there, which you're welcome to take a look at. And there are, our peer concerns are laid out full force. So if you want to know more about that, you're welcome to contact me. If you want me to go into detail, again, reach out, let me know. So again, it's a $1 million grant, and people thought that that was for DVAS. That's not true. So again, the article is in English. If you would like an ASL version, let me know. But basically, the $1 million grant is going to a specific organization to provide services to deaf, hard of hearing, deafblind kiddos in the school system. We do not agree with their choice. And so we're trying to fight for better services and a better pick next time around when this grant goes out. So trying to really work with our community. It's a long way to go, but we're not going to stop fighting. We are in it.
Yeah, we really need to work for the best support of our children. So it's just important to emphasize, that deaf students get access wherever they go. And it's, we don't have the deaf schools anymore, or don't have the deaf school in Vermont anymore. So for us, it's important just to advocate for our deaf community and their needs and their education. It's something that hopefully, we'll continue to fight for and will receive the recognition and support that it deserves.
Right. So again, if you have any questions or want to talk to me about this specific topic with the Agency of Education, please reach out. Changing gears, December. This is AIDS Awareness Month. And I remember, when AIDS first came about, we learned about HIV and AIDS. I didn't know much about it until a boy named Ryan White came to the forefront. Just a teenage boy. And what happened was he got AIDS via a blood transfusion due to a medical procedure. And it took the nation by storm. I know that he talked about his struggle in getting back to school because the school was so afraid to have him come back to school. This was the 80s, mind you. So there was a lot of hesitancy and unsureness about what's the safety and health protocol. So it was a nationwide story. So he's a big name. And Elton John, I remember, was a big advocate and proponent for his health and getting him back into school. So again, Ryan White, he did pass away from AIDS. And I want to say that was just before he graduated high school. Very striking. There is a movie about him. So if you want to learn more about that, please take a look, the Ryan White story. And I think about today, people with HIV and AIDS, they are able to live full lives because of medication that has come into being. Like the 80s to now, we've had vast improvements in the medical realm. And so people are able to live with AIDS and HIV. Do you want to add to that?
It's amazing how medication can really change from how it has changed from the 80s to now. There's so much preventative medication that's out there to help people who have HIV or AIDS. And for me, just learning about AIDS, I mean, to be honest, I don't remember, some of those stories. I'm just learning about some of those now. But I think, during my time, we didn't really have deep discussions about AIDS or HIV that much. It wasn't on the forefront of our minds. So I don't really know a lot about it at this point. So it's a very interesting topic. And I know sometimes it's not a comfortable topic for people to discuss, but we need to. And really, wow, how things have changed and improved. It's great.
Yeah, it's true. I think that for a while, people didn't want to broach the subject because it was very uncomfortable and they thought it as, oh, it's taboo and you shouldn't talk about this. And society needs to let that go and be very okay and upfront with talking about this topic. I do recall, gosh, it must have been a few different times that they had talked about how AIDS is transmissible. So it's transfusion, needle use or exchange, unprotected sex. So of course, with those types of things that people brought up, people were freaking out. But now that we've learned about it, we know how to protect ourselves. Yes, you can have protected sex. If you happen to share needles, make sure that you are mindful of that and you can protect yourself by instead not sharing needles, but keeping your needle to yourself if you are using.
Make sure they're clean.
Exactly. And so again, for folks that are, addicted to drugs and using needles, we have to be mindful that this is an addiction and people have ways to protect themselves, even if they are using.
Yeah, I think in Europe, they actually have a program where they provide clean needles for people who need them. or people who use drugs, they just want to keep everybody safe. And it's just important that people are aware that they don't use dirty needles or shared needles. Yeah, it's just in the US, I don't think we haven't got there. We're not quite on par with what Europe is doing in their program. So we'll see.
Wow, it's great that they've got that resource in Europe. We'll see if it comes this way. So speaking of December, we are in the holiday season and almost at the new year, welcoming 2022. Do you have any plans, Laura?
Um, yeah, a little bit, I'd say. I mean, during the holidays now, I'm really just looking forward to some rest, to be honest, some calm and some peace, doing some self-care, and hopefully getting some snowboarding in as often as I can here. It was great that snow has arrived here in Vermont, and I'm hoping to fly out to Colorado, which will be a nice change of pace. Just taking a little small vacation for myself. So I'm really excited about that. But really, I need a break. So I just need to get in that calm space, and I look forward to enjoying that time.
Oh, I totally understand that. I'm looking forward to the school break because it means that I don't have to worry about, getting up early, getting the kids to school. We can just sleep in. We can have family time. And I'm so grateful that all of us are still healthy. So hopefully we'll be able to enjoy the snow if we get some more. Right now, it's like a couple of inches at best. The temperatures have dropped. It'd be nice to have snow to go along with that. So I think that is it. Let's wrap us up for 2021. I will see everybody next year. Happy holidays.
Yes, happy holidays and happy new year to everyone.
Enjoy your holidays, Laura.
I look forward to seeing you all next year. Take care.
2022, here we come. Bye, everybody.
Bye-bye.